your host Piyusha Majumdar, and today we're having a conversation with Dr. Annette Boaz in order to disseminate the WHO's global research agenda on knowledge translation and evidence informed policy making. Dr. Annette Boaz is a professor of health and social care. She's a director of UK National Institute for Health and Care Research. She's also working at King's College London. Talking about her experience, she has more than 25 years of experience in supporting the use of evidence across a range of policy domains. She's also a part of one of the largest UK investment in the evidence use landscape, the Economic and Social Research Council Centre for Evidence-Based Policy and Practice, and was the founding editor of Journal Evidence and Policy. She recently chaired a session on the global dissemination on developing the global research agenda for knowledge translation and evidence-informed policymaking. Thank you so much, Dr. Boaz, for coming to our podcast. We would like to know that you have worked across academia, policy. What do you think? What is the most surprising cultural difference you have seen between these two worlds when it comes to how they handle evidence?
Yeah, that's a great question. I mean, probably the biggest difference is the pace of work of policymakers, which is very different from those of us based in universities. What I guess I didn't find is a really big difference in terms of their interest in using evidence, and also I was really heartened by their expertise and their own knowledge of the policy system, and their engagement really with research as part of that. So what I learned from that really is the importance of humility. So when you're working with policy from academia, to appreciating what people know already, their own expertise, and listening to what you can do to help from an academic point of view.
Okay, right, very true. How do we move from passive dissemination to truly actionable knowledge in a public health setting? I mean, how do you think that we can do this, like moving from passive dissemination to the actionable knowledge? What should we do?
I think the first thing I would say is actually that passive dissemination is still important. So it's still important that we share the work we do through traditional channels. We get those outputs out to different audiences. Still, the kind of papers and reports and blogs, the things we do and write about our findings are important, and they're a bedrock for our knowledge mobilization activity. But there's also so much more we need to do if research is really going to be useful to public health. And a lot of that work is relational. So it's about how we engage with people in different roles in the system, how we listen to what they need to know and think about how research can help them with the challenges that they face. And sometimes it's about working with people who are in the kind of brokering or intermediary space who can help us to make sure our research gets to the people who need it. So some of it's work we do ourselves, and some of it's working with knowledge brokers, mobilizers, technical assistance providers, or maybe the voluntary sector or other intermediary organizations who work in that space to support knowledge use in policy. But finally, I guess if we really want to move from passive dissemination alone, we need to address some of the systems challenges to the use of research. So how, for example, academics are incentivized in universities, whether there's that leadership of research use, whether the strategies and plans in place by policy organizations make room for research to be part of that process. So keep disseminating, build good relationships and context, but also think about what the systems we need to be are to support kind of research use in public health.
Since you were involved in developing the global research agenda on knowledge translation, so we would like to know, just walk us through this global research agenda, and we would like to know what motivated its creation.
So this has been a process driven by the World Health Organization. We started in 2023 to do a process of prioritization to come up with what the kind of core questions are that still need to be addressed in knowledge mobilization research and knowledge transfer research. So that was done through a really collaborative process. So there were consultations, online meetings, lots and lots of expertise from across the world were engaged in that process. Really good spread across the different WHO regions. And that process took us from a really long list of priority areas through to a much more focused list of 19 kind of key topics. The idea really was to address this gap between the evidence we have, so what we know, and policy, so what we do. And this was felt to be particularly important in the context of a rise in misinformation and also declining public trust. So we really worked to find out what we know about how best to support the uptake of research in policy, and then also to look at that evidence base, if you like, for this work. And we see it as very fragmented with some duplication, but also some real gaps and a real inconsistency in terms of funding. So hopefully these 19 areas will help us focus our efforts, engage funders, and really think about how we build a substantial, coherent evidence base for the work we do to support knowledge translation.
Yeah, I think, I mean, the world needs that. We really need to do our work towards knowledge translation, and people should, and there should be a capacity building also among the people, like to how to, do the KT. So, what do you think? What kind of innovation, whether technological or methodological, what do you believe that in from any of the two innovations, which will have the power to transform the future of knowledge translation?
Yeah, so in terms of innovation, I guess we immediately think of advances in information management and the prospect of AI, which I do think are going to be really valuable to KT, to knowledge translation and evidence use. And a lot of current investment is really focused in that area. So, for example, thinking about how AI can help us do evidence synthesis to support the use of evidence in public health. However, KT relies on a lot of relational work, as I said earlier, so work between people in different roles. And I think the real kind of challenge for us in terms of innovation, we're making sure we don't forget that. So we don't forget that however good the technology is in supporting us in our work, we really need to be thinking about how better to build this relational work, skills and infrastructure, so that when people have some evidence, we can also help them think about how to make it useful to them and to make it ultimately used to inform better policy making.
Being an AKT expert, we would like to know that if you had a power to change one thing about how the world approaches knowledge translation in public health, what would it be and why?
Yeah, so that would be a lovely power to have. So if I had that power, I think really I would be keen that we learn more from the past and from other fields so we don't reinvent the wheel all the time in our thinking about KT and evidence use. So we're really tempted when new people come into this area to think we don't know anything already, that we have to start from the very beginning. So set up things like, for example, fellowships and evaluate them. Whereas actually there's an enormous evidence base out there already. It is fragmented across different fields of work, but we could really learn from that existing work and not be constantly reinventing the wheel. So before we embark on new KT work, ask ourselves what we already know. So for example, at the moment, we're asking questions about how we can do KT frugally with limited resources. And we know so much from global public health about how to do that already. So how do we learn from that and draw that to other countries about how to do this in ways that aren't necessarily resource intensive, but can still be really effective? So that would be my big wish, would be that we remember just how much we do know already, and which was why the global research agenda was so important, because it helped us see that we know a lot already and to really hone in on what those actual gaps are. So what the things we need to address are in terms of kind of areas to invest in going forward.
Right. So, I would like to know what advice would you like to give to an early career researcher who's looking to contribute meaningfully to the global knowledge translation research agenda?
So the global research agenda is for everyone. So I would definitely encourage everyone to have a look at it. It Look at it and think about how you think your work might contribute to it. Make links to it so that people can see that you've looked at that work and you've seen how it connects with the work that you're doing and you want to do. Or you may be interested in helping with the development of a local or regional version, because we're very mindful that this is a kind of global research agenda, but we're hoping that in different geographical areas, in different subtopics, people might want to actually help to develop an agenda for where they live, for the context in which they live and work. So that would also be a really exciting area for us, is where people, and particularly early career researchers who I think are really engaged and sold on this idea of knowledge translation. Actually, it's really a big part of who they are as researchers, to actually think about, would you like to engage with this, and think about what an agenda would look like for where you live, or just to connect it with the work you're doing so that you can see where there are those parallels, and also help to promote the work that you're doing to others around the world.
Thank you so much, Dr. Annette. And one last question from my side. Uh, you know, uh, we are like, the implementation, those who are working in the field of implementation, those who are working, as an implementation scientist. So we find that there are very few opportunities in, getting engaged in the, academia, or the, the conferences that have been happening, particularly in IS, IR, or KT. So, do you think we should, there should be an opportunity to conduct more of this deliberation and discussions or conferences?
Yeah, definitely. So I think this comes back to my point about learning and not reinventing the wheel. So that we have so much learning in implementation science, for example, about how you do rigorous evaluations of implementation strategies and approaches. So much that could be really useful to the knowledge translation community that hasn't traditionally focused on developing kind of rigorous approaches to evaluating those interventions. So, and similarly, there's so much kind of theory and concepts and ideas and rich learning from other areas that we can learn from as implementation scientists. So it takes a bit of space and bravery to reach out across our kind of little communities we're part of, but it's really, really important in this area because we're all ultimately working towards the same goal, which is to make sure research can be as useful as possible, to have better public health going forward. And so, yeah, so definitely seeing those connections and learning and helping each other really with the areas we've made more progress on than others, and vice versa.
Thank you so much, Dr. Annette, for talking to us and the insights that you have given, especially regarding the global, research agenda and the implementation science. It would be really meaningful for our audience, and also those who really wanted to contribute toward knowledge translation and implementation science. Thank you so much.
Thank you.